Hello, this is our external analysis of the healthcare industry done by Orr, Ajan, Charvi, Dennis, Ethan, and Richard. So a quick overview of the healthcare industry and some of the things it provides. Provides medical services, the manufacturing of medical equipment and drugs, the medical insurance to those who need it, and it facilitates the provision of healthcare to its patients. Some of the inputs it requires are funds, human resources, medicine and supplies, physical infrastructure in the facilities, and information systems.
So there are a few major firms in the healthcare industry, as you can see on your screen. Some of them include CVS, McKesson, United Healthcare. And these firms are likely to succeed because they're the most well respected in the industry. And because of that, they have access to all the aforementioned inputs that are necessary. However, as a result of COVID-19, these inputs have been becoming more and more scarce, which does make it difficult for these major firms to succeed. So first we did an external analysis of the industry pre-COVID, and we utilized Porter's 5 forces to do so. So the first force is the bargaining power of buyers, and we found that before COVID, it was very high because there are numerous healthcare options, and there was a lot less urgency among patients to utilize these healthcare options. We found that the bargaining power of suppliers was actually low because there were more offering healthcare than those who actually needed it. We also found that the threat of new entrants was low because the well-established healthcare providers were dominating the industry, and there was really no need for new entrants to join the industry because it would be hard to enter. As for substitutes, it was high because there's an abundance of options when it comes to providers, like the major firms that we mentioned before. And the rivalry among competitors was also high because, as I mentioned, the market was really saturated, and therefore providers at the time were constantly working to improve their benefits and make their switching costs higher, so people stuck with them and didn't switch to one of the substitutes.
So continuing with our external analysis of the healthcare industry pre-COVID, we used a widely used tool that analyzes political, economic, social, and technological factors of a particular industry. So some political factors pre-COVID in the healthcare industry consisted of changes in tax legislation and changes in employment regulations. For example, changing in staffing requirements and overtime requests. Furthermore, some economic factors were unemployment and inflation and interest rates. For unemployment, obviously it's a huge factor. There'll be fewer people to purchase products and insurance, which would in turn contribute less money to the healthcare industry. As for inflation and interest rates, it has huge impacts on consumer and public spending, as well as government spending, because our government spends a lot of money on healthcare, especially for people who aren't able to afford it. As for the social factors, you have to know the demographics of your community. Hospitals are located everywhere. It's best to suit the people that are around you in order to make yourself be their number one choice. Same goes for values and beliefs. Refrain from violating widespread social norms that are particular to the community that you're in. And as for technological factors, equipment, treatments, and medicine constantly changing and improving for the better, as well as getting more expensive and more profitable. And also the advancement of information systems that basically allow companies to develop applications to make their software more usable, more user-friendly. Obviously, marketing, advertising, and then just all around communication. And here you can see a total 12-month net margin pre-COVID profitability chart. As you can see, since roughly 2009 up until, let's say, middle of 2014, and then beyond, they maintained a pretty steady stream of profit. This was mostly maintained due to the improvement of medical technology.
So next, our team conducted an external analysis of the healthcare industry during COVID. And to do so, we analyzed the Porter's 5 forces. So to begin with, we looked at the bargaining power of buyers, which we noticed became lower because of the number of people that were getting sick. And there just weren't enough options for healthcare providers for them. We also looked at the bargaining power of suppliers, which we noticed increased because many people required medical attention, thus forcing buyers to comply to suppliers' demands. As for the threat of new entrants, this remained low as times were uncertain and healthcare providers were struggling to retain and keep employees, and thus no one would try to enter the market as they knew they would not have access to the inputs needed. Substitutes were also low as demand increased and there was no longer an abundance of options for buyers. And for rivalry among competitors, this increased as access to the necessary inputs was difficult to obtain. We also conducted a pest analysis. So in the political realm, the government initiated lockdown mandates, and we also noticed a significant divide in viewpoints between political parties. The American Rescue Plan allocated $415 billion to public health care expenditures, and we also noticed telehealth expansion. As for the economic part, relative to past recessions, the health sector jobs decreased significantly, and after April of 2020, openings continued to increase. There were also dramatic increases in average weekly earnings for the health sector jobs and costs of medications, ventilators, and accommodations for frontline workers. For sociocultural, the overall lifestyle changed, as well as personal beliefs surrounding the healthcare system. There were also higher unemployment rates and overall a greater appreciation for healthcare workers. And in technology, we noticed that majority of technology was used to go towards vaccine development.
So after conducting these two analyses on the healthcare industry, we were able to recognize that the healthcare industry incurred a loss during COVID. And here are a couple reasons why. So during COVID, hospitals had to cancel a lot of emergency or non-emergency procedures to accommodate for all the extra patients that had COVID. And they missed out on a lot of potential revenue from those procedures, which was in part due to the bargaining power of buyers. But instead of it being a good thing, where they didn't have like anything to negotiate the price, it was a bad thing because they had too many buyers. And another thing was the high demand of extra medical supplies. And so hospitals had to purchase more supplies than they were expecting, which definitely came out of a huge chunk of their budget. And that also was affected by the bargaining power of suppliers. Another factor of COVID was overworked staff. And because of these overworked staff, they were working more late shifts and you had to pay them more overtime, which again came out of the budget. And it led to an increased turnover rate. So hiring new people is always going to be more expensive than keeping the ones that you have. Another caveat of the demand mentioned earlier was that the cost for PPE supplies increased, and that was due to a rivalry among competitors. And especially in the beginning, when there weren't a lot of competitors producing these things, they were hard to get, and the price of them just skyrocketed, which was due to demand. Yeah.
In terms of like the predictions moving forward, for the profitability of the healthcare industry post-COVID, for sure, people still experience long-term health effects due to COVID. Just generally, the pandemic has increased the demand for medical services due to its long-term effects, which continue to drive the profitability of the industry. As seen on the graph, you can see all the long-term symptoms that people with long COVID have. COVID accelerated trends towards digitization and telemedicine. The trend towards digitization and telemedicine was accelerated by the pandemic and is expected to continue to lead to more efficient and cost-effective healthcare delivery. There is an increase in investment in research and development. The healthcare industry is expected to continue to invest in research and development, which will drive the development of new treatments, drugs, technologies that can all be commercialized for profit. The expansion of insurance coverage, the increased insurance coverage, such as like the Affordable Care Act, is expected to lead more people seeking medical services, which will drive industry profitability. And lastly, the rise of new health tech startups. The healthcare industry is likely to see an increase in health tech startups offering innovative solutions for everything from diagnosing and treating diseases to managing patient health and wellness. In terms of which firms are going to win or lose post-COVID in the healthcare industry, the firms that will win would definitely be the firms that have adopted digital technology, such as like telemedicine and electronic health records are likely to have like a competitive advantage in the post-COVID era. Firms that can adapt to changing regulations, companies that are able to effectively navigate changes in regulations, such as those related to telemedicine, are likely to perform well as well. And lastly, firms that focus on value-based healthcare. Companies that focus on value-based healthcare models, which prioritize high-quality, patient-centered care at a lower cost, are likely to be successful also in the post-COVID era. In terms of the firms that are going to lose, traditional brick-and-mortar healthcare facilities are going to lose, just because like hospitals and clinics may struggle to remain profitable if they're unable to adapt to the increased demand for telemedicine and other digital health services. Another firms that will also lose would be firms that rely on only in-person visits. The companies that rely heavily on in-person visits for revenue, such as those that provide diagnostic imaging services or in-person rehabilitation services, may struggle as patients continue to opt out for virtual visits due to the COVID scares. But as restrictions lift, these firms are going to be back on the come up. And lastly, firms that with a limited digital presence definitely will not really succeed because the companies that have not embraced digital technologies, like I said, like telemedicine and electronic health records, definitely will struggle post-COVID as digital health becomes more and more important. And then lastly, our final thoughts. Just faced with numerous external factors before, during, and after COVID-19, there were external factors such as like aging demographics and technological advancements, which were driving growth and profitability in the industry. The pandemic brought unprecedented external challenges, such as decreased consumer spending, supply chain disruptions, and government regulations to control the spread of the virus. The healthcare industry was able to adapt in the changing environment. There's an increased investment, like I said, in telemedicine and a focus on providing essential services. And lastly, the external factors such as consumer confidence and government regulations will continue to play a significant role in shaping the future of the healthcare industry. Just overall, a comprehensive understanding of external factors is crucial for the healthcare industry to effectively respond to and recover from the impacts of COVID-19. And these are our sources. Thank you.